வணக்கம். இன்னைக்கு வேர்ல்டு ஆஸ்டியோபோரோசிஸ் டே. வேர்ல்டு ஆஸ்டியோபோரோசிஸ் டே எதுக்காக நம்ம அப்சர்வ் பண்றோம்? ஆஸ்டியோபோரோசிஸை பத்திய அவேர்னஸ் எவ்வளவு முக்கியம்? அந்த நோயை எப்படி கண்டுபிடிக்கலாம், எப்படி அதை குணப்படுத்தலாம், இந்த மாதிரியான கேள்விகளை பத்தி தான் இன்னைக்கு நம்ம பார்க்க போறோம். நான் மருத்துவர் கதிர் அழகன், எலும்பு மற்றும் முடநீக்கியல் மருத்துவர், காவேரி மருத்துவமனை. நம்மோட இன்னைக்கு இந்த கேள்விகளுக்கு பதில் சொல்றதுக்காக நம்மளோட சீஃப் ஆர்த்தோபெடிக் சர்ஜன் அரவிந்த் செல்வராஜ் சார் வந்திருக்காங்க. ஸோ லெட்ஸ் டிஸ்கஸ் அபவுட் ஆஸ்டியோபோரோசிஸ் இன் திஸ் டே ஆஃப் வேர்ல்டு ஆஸ்டியோபோரோசிஸ் டே. வணக்கம் சார். வை டு யூ ஃபீல் ஆஸ்டியோபோரோசிஸ்க்குன்னு ஒரு டே வச்சு அந்த டேவை நம்ம அப்சர்வ் பண்ணணும் அப்படின்றதுக்கான காரணங்கள் என்னவா இருக்கும் அப்படின்னு நீங்க நினைக்கிறீங்க சார்?
See, every year October 28th வந்து World Osteoporosis Day we are observing, because there is a reason behind that. Because the WHO have identified osteoporosis as one of the very common conditions affecting millions and millions of people throughout the world. It's such a common condition, and the awareness about the osteoporosis is very less, and it is one of the conditions with the proper measures like this diet, exercises, and medical therapy, the complications because of the osteoporosis can be prevented. So that's why, to create awareness among the population or the public of the world, the WHO has declared October 20th as a World Osteoporosis Day. For example, there is a lot of awareness about diabetes, cancer, cardiac disease, heart attack. All these conditions are common in general, people know about them. But how many of the common general public know about osteoporosis is the question.
Yes.
So to create awareness, and it is one of the conditions which, if it is identified early and treated early, the complications and adverse effects of the osteoporosis can be largely prevented.
வெல் சைட் சார். ஏன்னா லாட் ஆஃப் ஜேர்னல்ஸ், லாட் ஆஃப் பப்ளிகேஷன்ஸ் எல்லாமே வந்து ஃபாரின் பாப்புலேஷன்ல இதை எவ்வளோ சீக்கிரம் டயக்னோஸ் பண்றாங்க, இந்தியன் பாப்புலேஷன்ல அது ஏன் லேட் ஆகுது, இது ரிலேட்டடாகவே டிஸ்கஸ் பண்ணும்போது இட் இஸ் ஆஸ் யூ செட், இட் இஸ் மோர் அண்டர் டயக்னோஸ்டு கண்டிஷனாக தான் இந்தியன் பாப்புலேஷன்ல இருக்கிற மாதிரி ஃபீல்ஸ் ட்ரூ. ஸோ அந்த அவேர்னஸ் இஸ் நீடட் அப்படின்னு. ஸோ மோஸ்ட் ஆஃப் த டைம் நம்மளோட கிளினிக்கல் ப்ராக்டிஸ்ல ஆஸ்டியோபோரோசிஸ் இஸ் presenting more with a complication rather than coming as a clear-cut diagnosis. That is what you feel, sir?
Very true. See, as I said, when we identify diabetes, cancer, and cardiac as disease, osteoporosis is a condition.
Yes.
It's an age-related decline in the bone quantity. So, there has not been much importance given by the Indian public in understanding this condition. That's why, as you said, many times we see people, because of the osteoporosis, even after a minor fall, especially in the post-menopausal women, they come with fractures of the hip, wrist, or the spine. Then for the first time, the disease or condition is being diagnosed because of the complications of the condition rather than the condition itself. That's why we as an orthopedic surgeon, we have got a responsibility to educate public on the osteoporosis awareness. And it's about a diagnosis. The diagnosis is very easy. You have to do 2 simple blood tests and 1 simple scan called DEXA scan to identify conditions, particularly in the high-risk people like post-menopausal women.
Sir, since you ended that question with an answer, post-menopausal women are high risk. What other thing do you feel are other risk factors for osteoporosis? Or எந்த மாதிரியான people must be more aware of this osteoporosis, do you feel, sir?
See, let us concentrate on post-menopausal women first, right? Why women? Women nearly 50% of the population, and majority of them, as India also, as a population demographic changes, as we live longer, we will see a major part of the population in the post-menopausal women category. See, the estrogen, the hormone, is a very powerful stimulator for bone strengthening, right? In women close to the menopause and after menopause, since the estrogen stimulus for the bone becomes less, the bones start losing their strength very fast. Whether man or woman, we reach the maximum bone density by the age of 30. After the age of 30, with each passing year, there is a gradual decline in the quantity and strength of the bone, or the concentration of the bone cells. So, all these exercises, diet and all, to prevent this decline in the bone quantity, or to prevent the rapid decline. But in the women, because estrogen is a powerful stimulator of this the bone or the osteogenesis, as it becomes less around the menopause, the decline in the bone strength and quality becomes very acute during the menopausal days, and it becomes a rapid decline in the bone strength. See, that's why the post-menopausal women, the osteoporosis is screened. See, if you look at the spread of the osteoporosis condition or the incidence of osteoporosis, every third woman above the age of 50, they are found to be osteoporotic. Every fifth man above the age of 60, they are found to be osteoporotic. So in the Western countries, usually it is a mandatory or it is a common practice to screen all the women after the age of 50 every 3 years with the DEXA scan to rule out osteoporosis. Men also do get osteoporosis, but at a much later age, and also if they have got any coexistent disease like malnutrition or alcoholism, immobility, all these things can lead to osteoporosis.
ஸோ இப்போ நான் ஒப்பீனியன் என்ன அப்படின்னா மாதவிடாய் காலம் தள்ளி மாதவிடாய் முடிஞ்சு அவங்களோட தீட்டு நின்ன பீரியடுக்கு அப்புறம் இருக்கிற உமன்ஸ் ஆர் ரொம்ப ப்ரோன் ஃபார் டெவலப்பிங் திஸ் டிசீஸ். மென்னுக்கும் வயதாக வர்றதுக்கான பாசிபிலிட்டி அதிகம், பட் ஸ்டில் மென்னை விட உமனுக்கு வர்றதுக்கான பாசிபிலிட்டி கொஞ்சம் அதிகம். அது தவிர யூ ஆல்சோ மென்ஷன் ஆல்கஹால் கன்சியூம் பண்றவங்க, ஸ்மோக்கிங் அண்ட் இந்த மாதிரி புவர் டயட் மெயின்டைன் பண்றவங்க அண்ட் மென் ஹூ ஆர் நாட் ஆக்டிவ் வெரி மச் physically ஆக்டிவா இல்லாதவங்க, இதெல்லாம் ஒரு கேன் பி கன்சிடர் as a good risk factor. If that is the case, இந்த பேஷண்ட்ஸ் வந்து நம்ம கிட்ட யூஸ்வலா ஒரு போன் பெயின் இந்த மாதிரிலாம் ப்ரெசென்ட் பண்ணி வரும்போது எந்தெந்த ஆங்கிள் we can evaluate them, sir? Because when you said about 3 investigation, can you little more brief it?
Generally, for an orthopedic surgeon, the common presentation to the clinic will be a woman in the perimenopausal stage complaining of generalized malaise or weakness or bone and muscular pain, because once the bones start becoming weak, the bone forms a skeletal core support, so the muscles around the bone also provide a support. So then there is extra pressure on the muscles to maintain the posture balance, so they will generally feel very tired, weak, and so there can be several other causes as well, like the hormonal or metabolic, but one of the primary reason why they feel tired is a general the bone weakness. So that is one of the conditions. Or sometimes we see patients who present directly with a fracture of the, it would have been a simple fall, say a fall in the bathroom. If a man or woman in the age of 25 to 30, if they have a fall in the bathroom, majority of the time they don't end up in a fracture. But if women above the age of 60 or men above the age of 70, if they have a fall in the bathroom, majority of the time they end up with a fracture, like a fracture of the wrist bone or spine or the hip bone. So in our Indian condition, we see that osteoporosis being diagnosed mainly because of the complications they present with rather than being diagnosed primarily.
Okay, that's well said, sir. So எல்டர்லியா இருக்கும்போது தான் நமக்கு வந்து மொபிலிட்டி ரொம்ப தேவை அப்படின்ற ஒரு சுச்சுவேஷன் இருக்கும்போது கிராஸ்லி அண்டர் டயக்னோசிங் ஆஸ்டியோபோரோசிஸ் will lead on to develop more complication like fragility fracture, so they are more dependent at that age having multiple fractures. So that can be easily avoided by taking a simple investigation like ஒரு DEXA scanலாம் கொஞ்சம் ஏர்லியான ஃபேஸ்ல அவங்க எடுத்து பார்த்தாங்க. ஐ மீன் ரிஸ்க் ஃபேக்டர்ல இருக்கிறவங்க after 15 women and after 16 men DEXA scan எடுத்து பார்க்கும்போது definitely we can pick them or diagnose them quite early and avoid such complications. That's a great light of ideas. And by chance, without developing any complication, if the patient is coming or because of such awareness, if the person is coming with generalized gross body pain, DEXA scan it is graded as osteoporosis. In what way we can manage them?
See, I'll just rephrase this question. Rather than coming for diagnosis as an osteoporosis or to rule out diagnosis of osteoporosis, generally awareness about the bone health, right? Yes. Like we are all aware of the cardiac health, how do you prevent diabetes or neurological health. Like this general awareness about the bone health should be there, right? Yes. The bone health, as I said, only a small percentage of the people will need medical therapy. Majority of the people with the early stage of bone weakness, They can be treated with dietary supplements, a good exercise program. This alone will do in majority of the people. So the awareness about the bone health should be there. For example, the good diet, if somebody is vegetarian, more focus on the millets, legumes, and also if somebody can eat fish, all these, they are all rich in calcium supplements. And also there is a lot talked about the vitamin D. We can answer in a different question. So the advice is about creating general awareness about the bone health. And if somebody is specifically seeking around the post-menopausal stage to diagnose osteoporosis, we do this simple blood test, calcium, vitamin D, and the DEXA scan. From this, we can diagnose whether the bone strength is normal or is in the early stage of bone weakness, osteopenia, or is an advanced stage of bone weakness, the osteoporosis.
ஸோ இப்போ ஏர்லியாக சீக் பண்ணால் வித்தவுட் கிராஸ் ஆஸ்டியோபோரோசிஸ் இல்லாமல் ஏர்லியாக ஒரு போன் ஹெல்த்தை பற்றி அசஸ் பண்ணோம் அப்படின்ற நம்ம சீக்கிங் த டாக்டர் ஏர்லி வில் ஹெல்ப் அஸ் எந்த வகையில் அப்படின்னா ப்ராப்பரான டயட், ப்ராப்பரான ஹெல்த்தி லைஃப் ஸ்டைல், இது மூலமாகவே இந்த டிசீஸை வந்து நம்ம ஓரளவுக்கு கண்ட்ரோல் பண்ணி வைக்க முடியும் தேன் டெவலப்பிங் த டிசீஸ் ஆர் காம்ப்ளிகேஷன். பட் பை சான்ஸ் டிசீஸ் டெவலப் ஆகுது and they are diagnosed to have osteoporosis, is there any medical management available?
There's a lot of medical management. Why we do a combination of calcium, vitamin D, and DEXA scan? See, majority of the people we see, they found to be vitamin D deficiency. So the vitamin D deficiency can be treated with the initiation therapy followed by the maintenance therapy. The same thing with the calcium as well. We involve the dietitian very actively in our treatment process. They understand the diet pattern of the people, and then vegetarian, non-vegetarian, or fish eaters or non-eaters. And then accordingly they augment their diet, and the physiotherapist is also very actively involved in our osteoporosis program, who teaches the people about weight bearing exercises. So the diet supplements plus the exercise, and then when it comes to the medical management, the calcium and vitamin D supplements. And with this, large number of people with the early bone weakness can be managed. But people, when they are found with osteoporosis, then the responsibility becomes on us. How do we reduce the incidence of osteoporosis related fractures? We call this a fragility fractures. Then we use the medications called the bisphosphonates, which will augment the strength of the bone, that can be taken in the tablet form or injection form, depending upon the patient's medical condition, about their compliance. We can go for oral therapy, the tablet therapy, or the injection therapy.
That's well said, sir. So at the earliest, diet and health management. If diagnosed with osteoporosis, then medical management. இது எல்லாம் நம்ம மிஸ் பண்ணி அதை பற்றி அவேர்னஸ் எதுவும் இல்லாமல் if we ended up with a fracture அப்படின்னா தான் surgical management can ensure. So a better awareness at an earlier stage makes us to access a very easy and affordable and better treatment. So அதனால it is better we all aware about this disease of osteoporosis. Sir, fragility fractures, and of course நீங்க சொல்லும்போது hip fracture, vertebra fracture, spine fracture லாம் ஆகும்போது the patient goes for more of bedridden. Can you throw little in what other ways these fragility fracture can hamper one's lifestyle, and thereby osteoporosis awareness இன்னும் better reach ஆச்சுன்னா the people can avoid all this in future?
See, the two common fractures which make these people who are already in the elderly years, senior years, or one is a spine fracture, other is a hip fracture. So if there's a spine fracture, the spine is the core, and then because the spine goes into repeated micro fractures because of the osteoporosis, their mobility becomes very less. Many times they become bedridden. So these spine fractures, if it is due to osteoporosis, the fractures can be managed by a simple technique called the bone cement injection technique or bone fixation technique. And then a hip fracture, so that is one of the commonest problems throughout the world. I mean, right now, though it may appear that the elderly people with the hip fractures is a common Western problem, going forward, more than 50% of the people above the age of 60, that is the senior people, will live in the developing countries like India and China. Now the India and China together contribute less than 20% of the senior citizens, whereas in 2050, both countries will contribute more than 50% of this senior citizens age group. So we should be aware. senior citizen with a hip fracture, not treated well, and then if they are not able to be independent in their activities of the daily living, and if they are not able to walk around, the cost, the economic cost, or the financial and as well as the social stress on the immediate family is going to be tremendous. So that's why in our hospital, Kathir Hospital, we set up this the geriatric services with a special focus on orthogeriatrics, which is the first department like of such kind in India, where these elderly people with the hip fractures are admitted and they are resuscitated. They are, if the surgery is needed, the surgery is often as early as possible to make them independent in the activities of their daily living, including mobility. But the onus, when I was in the UK, the onus is on treating orthopedic surgeon to identify osteoporosis is not enough if you just treat the fractures with the surgery. The onus is on the surgeon to identify, does this gentleman or lady has got an osteoporosis as well? So how do we treat so that the patient does not have another fragility fracture? So in our hospital, we've got a very robust osteoporosis program. Every elderly people are clinically assessed whether they can have osteoporosis, then appropriately treated.
That's enlightening answer, sir. So, ரொம்ப நல்ல point. What I felt is when there is a fracture of hip, இது இருந்துச்சுன்னா வெறும் சர்ஜரி மட்டும் பண்ணி அந்த ஹிப்பை மட்டும் ஹேண்டில் பண்ணி அனுப்புறதை விட we should treat the patient as a whole, because as per research and data எல்லாம் என்ன சஜஸ்ட் பண்ணுது அப்படின்னா ஒரு fragility fracture வந்துச்சுன்னா that is the single most potential risk factor for developing another fragility fracture. So அப்படி இருக்கும்போது so treating the patient as a whole and then proper rehab methods and other and everything is more important in order to prevent such fractures in the future also. So that's an enlightening point. And in what other way as a rehabilitation osteoporosis endha vagila we can help patients, especially elderly who are staying alone?
See, people who are staying alone, we have to remember they have to be independent in their activities of the daily living. That means eating, taking care of themselves, walking up to the restroom, grooming themselves, all these things they have to be independent. Right? And the diet is also very important. That's why we have got a physical medicine and rehabilitation department. See, if an elderly a gentleman or lady has got a hip fracture, and then the hip fracture has been operated upon, and if that lady or man has to walk with the help of walker, the arm has to be strengthened. Yeah, the hip they are operated upon, but if the arm is not strong, they won't be able to use the walker. So that's why the arm strengthening exercises and also the neurological balance, whether they've got good balance, and also whether are they on any medications which causes the imbalance, everything has to be assessed. So the rehabilitation forms a big role in restoring the people back to their pre-injury or pre-fracture level of mobility.
And also about the fall prevention and other things we can wonderfully do with rehab people and the support. And there is an audience question. Sir, I am suffering from a vascular necrosis, both hip and I was advised surgery, but I am very scared to undergo surgery. Is it curable with medicines alone? And also to say, I am a cancer survivor. Please do reply.
Sure. Avascular necrosis, if it is diagnosed at the very early stage, we have got classification based on X-rays and MRI scan. If it is diagnosed at an early stage, we can do simple interventions. One is medical management with an intravenous medication, or a non-replacement surgical intervention called a core decompression and bone grafting, where we retain the original hip and still decompress the hip joint to restore the vascular supply, can be considered. But in our experience or in worldwide experience, what we have observed is many times these patients end up in hip replacement. So with the bilateral avascular necrosis, which is very symptomatic, which is preventing your mobility, hip replacement is a wonderful, very successful surgery. It is not a surgery which is on an experimental basis or which is not done only in the last few years. We have been doing here, the orthopedic community has been doing hip replacement surgery for the past 50 years. And the last 15 years, we have been doing orthopedic hip replacement for the 50 years. The last 15 years, the technique and the implants have been so standardized. Now there's no need for anyone to question about whether the surgery is necessary or not. Any average orthopedic surgeon can do a good hip replacement surgery, and particularly a symptomatic both sides avascular necrosis definitely can benefit a lot from hip replacement surgery. And the cancer survivor, cancer is no contraindication for hip replacement surgery.
Of course, mobility is most important. So definitely that needs to be addressed. And with related to diseases like cancer, such patients, do you feel that possibility of developing osteoporosis is more when compared to the normal population?
Yes, like cancer people, because of the reduced mobility and the various medications that they are on, and also many a times, so for example, somebody has got an upper GI cancer and all, their nutrition also will be compromised. Because of these reasons, they are prone to develop osteoporosis. In fact, my advice to the young doctors will be any hospitalized patients should be assessed for malnutrition, and any hospitalized patient should be assessed for the bone weakening or osteoporosis.
Okay. So considering the potential risk factors, be it a cancer survivor or very elderly or postmenopausal ladies or people who are grossly obese, any risk factor, it is better to go for assessment of other than just managing this, what would be your recommendation for the youngsters if they want to prevent developing an osteoporosis in an elderly?
See, let us put this questions. In fact, in one of the TV interviews, one person asked, see, my son who is 11 years of age, he repeatedly falls and many times ends in having a fracture. Does he have osteoporosis, right? See, the children are there, children are going to play, they are going to fall. Many of them can develop fractures. Not all children's fractures are osteoporosis. But if somebody, even with a minor innocuous injury, the child develops a fracture, then there's a condition called osteogenesis imperfecta, where there's a congenital deficiency where the child is prone to develop fractures even with a very, very minor injury. Or the child has to be assessed for a vitamin D deficiency, the rickets and all. As I said, you reach the maximum bone strength by the age of 30. So if at all something is under your control, you want to have a maximum impact or you want to gain the maximum bone strength, be very, very active in the late adolescence and the early adulthood. Do all the weight-bearing exercises. Be active. Be outdoors. Even if you are working in information technology or a desk-related job, make yourself as active as possible to give maximum strength to the bone. So if you have enough bone reservoir up to the age of 30, after the age of 30, even if the bone decline happens, you can continue to prevent the rapid decline in the bone quantity by keep on doing the regular exercises, having a normal or a very healthy diet, and also moderate consumption of alcohol. Everything with this, you can continue to maintain the good bone strength.
Okay, sir. There is a question. After getting diagnosed with osteoporosis, is it advisable to go for regular activities like jogging, running, such a high impact exercise? Can it be done?
See, the osteoporosis, depending upon the age, or you can, at this point of time, you can bring the another condition which is commonly misunderstood is osteoarthritis. The common question people will ask is, doctor, do I have osteoporosis or osteoarthritis? See, for example, if you take the lower leg, we have got a thigh bone, we have got the leg bone. So these are bones. Any weakness of the bones leads to osteoporosis. Between the thigh bone and leg bone is the knee joint. If there's a wear and tear, the age-related wear and tear in the joint, so the joint is between the thigh and leg bone. If there's any wear and tear in the joint, it is called osteoarthritis. High impact bearing activity like jogging is generally not conducive for the joints in a person who has already got osteoarthritis or osteoporosis. because it may increase the further damage. But there's a lot of other activities available which can continue. A qualified therapist can suggest what are the activities are suitable for each individual, which can be impact bearing or weight bearing or resistant exercises like using TheraBand and all. So you give a resistance to the muscles then stimulate the bone. So you keep the bone turnover keep going on. So there's a lot of exercises other than the jogging which can be good for the bone and joint health. But if you have mild symptoms, and also the X-ray suggests that you don't have a severe osteoporosis, osteoarthritis, jogging or fast walking preferably is a better form of exercise.
Okay, so osteoporosis irukku, which is happening the regular day-to-day activity அப்படினா pain tolerated whatever it is possible they can do. So walking லாம் consider பண்ணலாம், but ஆனா gross osteoporosis இருக்கும்போது running மாதிரியான high impact exercise avoid பண்ணிக்கிறது.
Yeah, I mean because even a small trip can lead to a fracture. True. I mean, even on osteoarthritis, when we recommend knee replacement, many times people will ask, while waiting for the knee replacement, doctor, can I do walking and all? I mean, even until the day before the surgery, you have to continue to do the walking, right? Even if the joint is a degenerate, by doing walking and regular exercises, you strengthen the muscles, thereby you reduce the pressure going through the joints.
Okay. Another question is, my mom age 60 suffering from knee pain and thigh pain, and can you advise us what kind of diet that she can take?
See, depends upon whether she consumes vegetarian or non-vegetarian, or if they can take fish. See, the diet pattern. So first of all, we have to understand whether they got enough dietary supplements in their regular diet, or if they got any lactose intolerance. If there's a vegetarian, consume plenty of millets. And if somebody can consume fish, as a fish is a good source of calcium. All this, the dietary, and also if you are going for a soya milk, see whether it can be fortified. You get as fortified with the calcium and vitamin D, tofu. All these are rich sources of calcium. Any nutritionist or dietitian will be able to give you good advice on how do we get enough dietary calcium supplements.
So
another common question get asked is vitamin D. How do we go about that? See, the vitamin D, the natural supplements in the form of diet is very less. So that's why we see a significant percentage of our population is deficient in vitamin D, particularly in the Indian population, because we are largely a dark-skinned population where there's a high concentration of melanin in the skin, which is a deterrent to conversion of the active form of the vitamin D. That's why, compared with a Caucasian white man or woman, the Indian population need the exposure to sunlight for a prolonged period of time to get the same quantity of the vitamin D. So the vitamin D is, there's a lot of awareness, talk about the vitamin D in the last 10 years. But if your vitamin D is deficient, and if you are taking an appropriate dose regularly, there is no harm in taking vitamin D supplements, but you just make sure that you just take the appropriate dose, not the overdose.
Okay, so which means when compared to foreigners, compare பண்ணும்போது இந்தியன்ஸ்க்கு தான் osteoporosis வரதுக்கான possibility, especially because of the vitamin D deficiency is more. That's a very great point, sir. So in that case, with related to the calcium supplementation, so overuse of calcium, especially இது related ஒரு question என்ன வரும் அப்படின்னா, கால்சியம் நிறைய சாப்பிட்டோம் அப்படின்னா renal stones வருது, calcium related side effects வருது. So is it really advisable to take calcium for a prolonged period அப்படின்னு கேட்டா, what is your opinion?
This is a common question because we talk about the calcium as on the bone, but the majority of the time we give pure vitamin D supplements rather than calcium supplements. If at all calcium supplement is also added, depending upon what element of a calcium and how much the strength, a supplement in the less than the prescribed dose or the prescribed dose is always safe. But anything above that, a therapeutic dose of calcium if somebody is taking, they should consult the doctor who prescribed regularly, just to make sure that they don't end up in taking large amounts of calcium.
So which means calcium over the counter medication போயிட்டு pharmacy வாங்கி abuse பண்றது definitely is not advisable, because most of the time they will end up eating more dose. So, but a prescribed calcium within like 1,200 milligrams, which is suggested dose, is definitely can be taken.
Over-the-counter prescription of calcium, over-the-counter availability of calcium and vitamin D is available as long as it is less than that the maximum limit. But any therapeutic dose of calcium, you have to consult the
Consult. Okay. So, renal stone possibility is there.
It is there.
It is there. Okay. So, what other tablets we generally prescribe other than this calcium, vitamin D, like bisphosphonates you were telling? So, should it be taken daily or?
See, for example, vitamin D. If somebody's vitamin D is a normal recommended is at least it should be the number 30 above. So if somebody is severely deficient in vitamin D, we start off with a loading dose of vitamin D once in a week for 8 weeks to the 60,000 units, then as a monthly supplement. So depending upon how much you deficient you are in calcium and vitamin D, then vitamin D supplements once in a year, once in a month can be taken for a prolonged period of time, provided you regularly consult with your doctor.
So actually, exactly that's the question asked by Sangeeta. I think Sangeeta, we answered your question. And the next question is about bisphosphonates. Do bisphosphonate medicine help people with osteoporosis to get better or just to keep them from getting worse?
This is a very good question because the bisphosphonates, see, it is definitely for bone augmentation. It helps to prevent rapid decline in the bone quantity or rapid decay. So if a person is diagnosed with osteoporosis at the oral or injectable form, one thing, particularly from the orthopedic surgeon, why we recommend bisphosphonate is to prevent the fragility fractures. So, and many times the one spin-off good effect is as the bone turnover gets consolidated and the bone quantity gets stabilized, many times people feel better. They feel that doctor, I don't have the sort of bone pain that I used to have. So the primary indication for the bisphosphonates is to prevent the incidence of the osteoporosis related fractures. And the spin-off good effect is because it strengthens, it prevents the rapid decline in the bone. The people normally feel that the bone pain has considerably reduced.
And again, I think or information correct convey achana. The point is that by chance, if I am taking vitamin D and calcium as a regular medication prescribed by my doctor, can I stop it considering because you told the renal stone as a complication of ketukanga? I don't think that is advised. Yeah. It is better.
Now, let me make it clear. As long as your calcium and vitamin D supplements that you are taking is monitored by your doctor at least once in 6 months, then you are safe. So this is a common misconception. People, even if a doctor prescribes the appropriate dose of calcium supplements, they assume that, oh, they may get the kidney stones and they don't take it. So as long as under the supervision of a doctor, yes, that can be safely taken. Particularly in the post-menopausal women or women who have undergone surgeries like a hysterectomy and ovary removal, they should be actively prescribed the calcium and vitamin D supplements.
So on your own, please don't stop the calcium and vitamin D, and it can be taken as long as it is prescribed by the doctor. So please be under the supervision. So that is what's suggested. Sir, anything as a conclusion that you want to say that to the people, that how they should be aware of osteoporosis and what are the things that should awaken them that they may be a victim of osteoporosis, that they should reach hospital?
See, let us clear the myth or misconception about osteoporosis. Many times people get panicky. Doctor, I have been diagnosed with osteoporosis. Osteoporosis is not a disease like cancer or diabetes or cardiac disease. It is a condition. As I said, we reach our maximum bone density by the age of 30. After that, with each passing year, there's a decline in the bone quantity. We are doing all this program to create awareness about this, so that we can enrich our bone strength by having appropriate diet, calcium, vitamin D supplements, regular exercises, and in spite of that, somebody develops osteoporosis in the vulnerable people, how it can be actively treated. So the message on this World Osteoporosis Day is to create awareness about osteoporosis and if it is diagnosed early, it can be treated very well. Thank you.
And last ஒரே ஒரு question கேட்டிருக்காங்க சார், but I think can taking thyroid hormones cause me to have greater chance of getting osteoporosis? Precisely speaking, any hormones is having both even. For example, thyroid hormones, if you take in excess, then it can lead to osteoporosis. And at the same time, hypothyroid patients, thyroid hormone is needed. So if at all you are a thyroid patient and you are on thyroid hormone supplementation, please don't stop your thyroid hormone saying that it may cause an osteoporosis. See, every hormone related issue, be it a steroid related or patient who are rheumatic, who are taking lot of medications related to steroids, those steroids may cause osteoporosis. Stopping such drugs in the middle may cause much harmful effects. So consider the risk benefit ratio before you taking any choice. Please be under the supervision before you stop or start any medication with related to osteoporosis. So please consult your doctor with related your queries and other inquiries with related to osteoporosis. Thank you.
Thank you.
Thank you.